When taking blood sample from the arterial line, the nurse should, answer is, discard the first 5 ml and then collect ABG sample. Excess diuretic administration can lead to, answer is, metabolic alkalosis. 43-year-old Dinesh is admitted to the hospital with a diagnosis of COPD with severe respiratory distress. The ABG results are pH 7.36, PaCO2 70 mmHg and HCO3 36 MEq per L. What acid-base disorder is shown? Answer is respiratory acidosis fully compensated. Mrs. Radha was suffering from persistent vomiting for 2 days now. She appears to be lethargic and weak and has myalgia. Measurement of arterial blood gas shows pH 7.5, PaO2 85 mmHg, PaCO2 40 mmHg and HCO3 34 mmol per L. What acid-base disorder is shown? Answer is metabolic alkalosis uncompensated. The height and depth of the finger prick in children less than 8 years is, answer is 1.5 mm in middle or ring finger. For children weighing more than 10 kg, the appropriate site for drawing CBG sample is, answer is fingers. The normal pH of blood is 7.35 to 7.45. Starvation can lead to ABG changes. Answer is reduce pH and reduce HCO3. The parameter that is expected to the acid-base change that lead to over-excitability of CNS is, answer is metabolic alkalosis. Mr. Raghu was having a history of uncontrolled DM, was brought to the hospital with a fever and vomiting and a decreased level of consciousness. The patient displays slow and deep Kushmal breathing and he is lethargic. ABG shows pH 7.12, PaO2 72 mmHg, PaCO2 23 mmHg and HCO3 12 mmol per L. Other results are sodium 126 mmol per L, potassium 5 mmol per L and chloride 95 mmol per L. What is your assessment? Answer is metabolic acidosis partially compensated. The incorrect nursing intervention following radial arterial puncture is, answer is apply direct pressure to the puncture site for 2 to 3 minutes. The following artery is not used for drawing blood for analysis of arterial blood gases. Answer is popliteal artery. Mr. R has copious vomiting, which is coffee ground secretions. He is not oriented to person, place or time. The results from the ABG shows pH 7.57, PaCO2 37 mmHg and HCO3 30 MEq per L. What is your assessment? Answer is metabolic alkalosis uncompensated. Mrs. Jiva, who had undergone surgery in the post-anesthesia care unit, is difficult to arouse 2 hours following surgery. She was given injection morphine for post-operative pain earlier. Measurement of state ABG shows pH 7.10, PaCO2 70 mmHg and HCO3 24 MEq per L. What does this mean? Answer is respiratory acidosis uncompensated. Patient is continuously suffering with abdominal pain and anxiety. The possible acid-base imbalance is answer is respiratory alkalosis. The area to be avoided while doing heel prick is answer is posterior aspect of the heel. The type of respiration present in respiratory alkalosis is answer is hyperventilation. During a CBG, little finger is avoided because answer is less pad of fat and more painful. While drawing sample for ABG, the nurse is expected to do all except answer is withdraw the blanket on seeing the flashback of fresh blood. Mrs. Ganga is a 54-year-old widower with a history of COPD and was rushed to the emergency department with increasing shortness of breath, pyrexia and cough with yellow-green sputum. Upon examination, crackles and wheezes can be heard in the lower lobes. She has a tachycardia and a bounding pulse. ABG shows pH 7.30, PaCO2 68 mmHg, HCO3 28 mmol per L and PaO2 60 mmHg. How would you interpret this? Answer is respiratory acidosis partially compensated. The arterial blood gas analysis is indicated to note the adequacy of all parameters except answer is fluid volume status. Recommended temperature for hot application for arterialization of the chosen site for CBG is 42 degrees centigrade. The electrolyte loss associated with metabolic acidosis is potassium. The arterial blood gas can be taken from any limb with answer is positive Allen's test. The complications to patient after performing the procedure to analyze arterial blood gases are following except answer is needle stick injury. Mr. A, who met with accident after drinking beer at a party, his friend brought him with unconscious, depressed ventilation, shallow and slow respirations, rapid heart rate, and is profusely bleeding from both ears. Which primary acid-base imbalance is Antony at risk for developing? Answer is respiratory acidosis. Arterial blood sampling can be performed safely on patients who are taking aspirin. Just for accurate ABG result sample should be taken. Answer is 20 to 30 minutes following ventilator setting change. All the following can lead to wrong ABG values except answer is samples taken analyzed in room temperature. Presence of air bubble in the ABG sample limit the accuracy by answer is increasing the pH, PO2, SaO2 and decrease the PCO2. In primary metabolic acidosis, the changes in ABG are answer is reduction in pH with decrease in HCO3 and normal PCO2. Use of femoral artery is not considered because of the following limitation except answer is it is hard to identify the artery. The cause of respiratory acidosis is answer is ventilation problems in the patient. The most preferred site for arterial puncture is radial artery. The site associated with the risk of infection is Answer is femoral artery. Before performing the procedure to draw blood for analysis of blood gas, the nurse is unable to feel the strong pulsation because of answer is hypovolemic status. The time limit for accurate analysis of ABG sample in room temperature is less than 10 minutes. Holland's test is performed before radial artery puncture to confirm adequacy of collaterals in the hand from ulnar artery. Baby Aguila was rushed to the emergency room following her mother's complaint that the infant has been irritable, has had diarrhea for the past 3 days. The infant respiratory rate is elevated and with dehydration. The CBG result shows pH 7.38 and PaCO2 25 mmHg and HCO3 90 MEq per L. What does this mean? Answer is metabolic acidosis fully compensated. The normal ratio of acid base is answer is 1:20. Respiratory alkalosis with metabolic alkalosis is seen in answer is COPD patients with a high FiO2. The primary respiratory buffer is answer is carbonic acid. The two organs maintaining the acid-base balance are answer is kidneys and lungs. Starvation can lead to ABG changes. Answer is reduce pH and reduce HCO3.